From the standpoint of the facility, the protocols are designed to generate revenue. They improve the patient retention, and they reduce communicable disease discharge. They reduce the risk of drug diversion, and it gives the ownership certainty. It also creates a self-monitoring process. If you have a problem, the first thing that a federal investigator is going to ask is, what have you done about this? And when did you know about it? And what did you do to prevent this from happening? Not, it's good that you found out, or not, did you cover it up? Could you have prevented this in advance? Could you have learned? Could you have figured it out? And that's what we're trying to do. We're trying to get ahead of problems before they occur. And you know how hard it is to get positive reviews for a facility? And the reason why is the workers in the facility are so busy working, and the management is so busy working, that no one's there to hear the positives. And if you had an extra 20, 30, 40 positive reviews a year, it might be the difference between having an 85% occupancy and a 95% occupancy. And getting positive reviews could be worth tens, 20s of thousands of dollars for you. And that's something that no one's actively doing. We can elicit those positive reviews when we're talking to the patient, because the patient is going to brag about the facility that they're at. And it'll also give certainty to the family in our CareGuard 360 program that, hey, my loved one's being taken care of. And they don't feel as guilty because they haven't been able to get there this weekend or this week. And they know that somebody is keeping an extra eye on things. And they can see those positive reviews, and they know that this is a good facility, and they can brag about the facility that they put somebody in instead of being shamed about it. So let's talk about a little bit about how CareGuard actually works. There's a scan code that occurs. That scan code is something that is on your website. There's also a transparency that you can put on your doors. There's also various other places that we can get you a logo. It's specific for your site. It goes right to a form, and that form allows somebody to give both positive and negative feedback. This could be an employee saying, I'm being harassed at work. This could be another caregiver saying, hey, I noticed something going bad over here. This could be a family member. It could be a visitor. It could be your own management team saying, hey, I want to report this anonymously, but this needs to be taken care of. It could be anybody. It could be somebody walking past. And that piece of information, that data, goes straight into our analytics. Now, we have another program called CareGuard 360. CareGuard 360 is a for-profit program. CareGuard itself is nonprofit. CareGuard 360 is for-profit. CareGuard 360 charges $360 a year to the patient's family. And what we do is we come in once a month and we look at the patient. And we look at all parts of the patient. We look all the way around them. And if the patient's getting ecchymosis, bruising, wounding, if they're not doing well, we identify that. And we indicate what needs to happen and who do we want to get in there to help fix this wound issue. We want to make sure that the patient's not getting restrained. We want to make sure that there's appropriate mobility, and we want to do a sniff test. We want to make sure that there's no evidence of infection or hygiene issues. And I'll go through that CareGuard 360 program in a little bit here. All of these are data points. The QR code reporting, which anybody can report, or even our CareGuard 360 program, where our data points go in. They all go into a reporting mechanism. That reporting mechanism splits the information. It creates an anonymous report that splits the demographics off. It certainly has information as in terms of region. It has information about the event, but it doesn't have information about the patient. It stays anonymous. That information is transmitted to AHRQ, which is part of the patient care organization, under a common data transmittal protocol. And that information is used for the federal government to help identify areas of high risk and improvement. At the same time as we do that, the report that is the unblinded report, the non-anonymous report, goes straight to the attorney. The attorney that is the designated attorney for the facility that works with CareGuard then takes pieces of that information, decides, hey, this does not rise to the level of anything, and nothing needs to be done. Or I need CareGuard to go out during their CareGuard 360 look, and I need them to do a compliance check. I need to figure out what's going on, and I need to get additional information to figure this out. Or I need to hire an outside investigator, or I need to contact the EOC, or I need to do whatever. All of these things are under the purview of the attorney. Now, they engage CareGuard here, and at the same time, CareGuard gives a report back to the attorney, not directly to you, because you're the ownership group, and then the attorney communicates with you. So there's no communication between CareGuard and the ownership group directly. It goes through the attorney and thereby maintains the non-discoverable work product. We can't be subpoenaed because we're providing information to the attorney through CareGuard 360. CareGuard itself can't be subpoenaed because it holds only anonymous information, and it's a nonprofit, and it's a patient care organization. So all of this data stays safe within the spectrum of appropriate care and within the spectrum of attorney work product. So we're not an archive. We have a data non-retention agreement. We're not a Medicare contractor. We aren't an insurance product, and we're outside of ERISA. We are not a laboratory. We use lab information, and we don't directly provide medical care. We coordinate that care. We're an independent organization that coordinates care with a variety of other vendors who are providing the services. We're agents that work for your legal department to provide threat awareness. We provide certification for your facility so you can document to the insurance companies, to the clients, to the families, to the hospitals, anybody that has an interest, including to the Department of Justice and the DEA and Medicare and any other investigators, what you're doing to make this a better place. And we are able to encourage and elucidate and document those positive reviews. And if there's negative reviews, obviously those go straight to the attorney because they've got to investigate it. They need to figure out what's going on. So this gives you a certainty that things are going to get taken care of. What we've designed is non-confrontational reporting. So it's a badge. And you use this is an active QR code. So you can report and see what these reports look like. So you'll have this kind of badge at your facility, and your website will have a CareGuard certified on its site. And wherever you need to put it, you can show that you're certified. It's another way to help differentiate yourself from everybody else. It's how do you make yourself stand out so that it's easier for you to recruit high quality patients. It's easier for you to keep your facility full so that you can provide the services for your patients. We certify nursing homes for compliance. We want to certify them for safety. We have over 300 different checkpoints that we do when we come into the facility on a monthly basis. It's not likely that anybody is going to run around and fluff the pillows when we're coming in because we're just regular people. We're not JCO. We're not here as some sort of overarching massive governmental bureaucracy that's coming in to look. We're just regular people. And we're making sure that patients are screened for urinary infections, upper respiratory tract infections, balance, stability, metabolic health. And all of these things lead to improved patient care. And all of them also lead to improved revenue. And they lead to better outcomes for the patients. And they protect you. They protect your facility from litigation. Because if you get ahead of the problem, it makes the problem disappear. But if you're having to chase the problem, it may be too late. The best time to get ahead of these problems is right when they're occurring, and not let the ego of the staff get in the way. And that's something that I learned a long time ago in this business, that sometimes ownership doesn't know what management's doing, and sometimes management doesn't know what the employees are doing, and sometimes the employees don't know what the patients are doing. So there's a whole host of things that can go wrong here. And helping us create that transparency in a non-confrontational way is the whole purpose of CareGuard.